Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho Matters is taking a deep dive into the loss of farmland here in the Gem State. Are you a farmer? What challenges do you face as farmland shrinks in Idaho? We want to hear your story. Email us at idahomatters@boisestate.edu or leave us a voicemail using the Talk to Us feature in the Boise State Public Radio app. And then listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons in the Idaho Matters podcast feed. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. Health and Human Services Secretary Robert F. Kennedy Jr. is drawing new criticism after suggesting infant circumcision and the use of Tylenol could be linked to higher autism rates, a claim medical experts say is not supported by evidence. Now, during his remarks late last week, Kennedy cited a 2015 study out of Denmark, but researchers from that study did not examine the use of painkillers like Tylenol, and they cautioned their findings showed only correlation, not causation. And now scientists and doctors are warning that Kennedy's remarks could spread misinformation about a sensitive and complex public health issue. Joining us today to talk more about this is Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you do have a public health question, send us an email at idahomatters@boisestate.edu. We will get to some questions later on today. But first, Dr. Pate, I want to talk a little bit about this study from 2015 in Denmark. What did the study on circumcision and autism actually find?
So there was a correlation, meaning that they looked at children before the age of 10 undergoing circumcision and saw that that group seemed to have a higher frequency of autism. However, it was made clear by the authors, as you mentioned, that that's correlation. That doesn't mean that the circumcisions caused autism, and certainly based on everything that we know about autism, and admittedly, we don't know the whole story, it makes no sense that circumcision would, quote unquote, cause autism. Autism is a process that is highly influenced by genetic predisposition, by events that occur during the fetal development in the womb. And so a single event, such as a circumcision, just really makes little sense as to how that would even potentially cause autism. And so the authors cautioned coming to that conclusion, and unfortunately, RFK Jr. has brought this up without really understanding it, and has said that that his view was it wasn't the circumcision itself, but the fact that mothers would give those circumcised boys Tylenol. But again, we have not seen any evidence that acetaminophen or Tylenol plays any role in causing autism. So I think this was very irresponsible to throw this out. If they want to study this, fine, but there's certainly no conclusion to be made. And I think this is a continuing effort somehow that is to make parents feel like they had some kind of role in causing their children's autism. I really don't quite get it yet.
So, Dr. Pate, how do researchers distinguish between correlation and causation in studies like this? Because I think, that's it's kind of hard sometimes to understand what that means.
Well, it is. And so the example that I use to try to make this simple for people who don't understand these concepts, which most people don't, is for example, if if during the first year of COVID, I had a group of my friends who think similar to me. That is, that they should
Hmm.
take precautions about COVID. And if you looked at our group and none of us got COVID that first year, and what you noticed about my group is that we were all coffee drinkers, uh,
Mm.
and that you looked at another group that got COVID and they didn't tend to be regular coffee drinkers like me and my friends, then you might say, well, there seems to be a correlation. And that is that if you drank coffee, you didn't get COVID. But that doesn't mean the fact that we drank coffee every day spared us from COVID. It may be something else. And so, for example, in my friend group, were people who were paying attention, trying to take precautions to protect themselves. And what you might find if you actually designed the study to answer the question was that the causes, you might find out, there's a bias. This group that drank coffee actually was taking mitigation steps like avoiding large groups, wearing masks when out with others, and find that that was only a correlation. It wasn't the coffee at all. It was something else related to that particular group. So that's how I kind of use an example to explain it. And this study was not designed to answer the question, did Tylenol cause autism? Because as you said in the lead
Hmm.
up, they didn't even record that as an element of the study, whether any of these children were administered Tylenol or acetaminophen or not. So you can't draw that conclusion. What you can do in a study that shows causation is you can say, oh, well, I mean, that shows correlation. You can say, oh, well, that's interesting. Now let's design the study so that we can test that. In other words, you would take large groups of people. One group, you would have them undergo circumcision with no administration of acetaminophen. Another
Hmm.
large group that got it, and try to compare them head to head. That has not been done, and there's no evidence that either circumcision or the administration of acetaminophen to young children causes autism.
Hmm. So, Dr. Pate, my understanding in regards to when you should start giving an infant Tylenol is that you should not give it to them under 12 weeks of age. And most circumcisions happen shortly after birth. I mean, within the first 24 to 48 hours. And I am fairly certain that neither of my children were given Tylenol after this procedure. Neither of my children have autism either. So I guess my question is, how common is it that these babies are given Tylenol after circumcision, given that you're not supposed to give it to them under 12 weeks of age? Oh, Dr. Pate, can you hear us okay?
Yes, did I go out?
You did go
Okay,
out. So if you could start
oh,
that
okay.
over, yeah, that'd be great.
I I will. Sorry. So you bring up a really good point that RFK Jr. could benefit from learning from you, and that is you have to look at these study details. So, for example, you are right. Contemporary practice is if we're going to have children undergo circumcision in the United States, by and large, a lot of that happens right after while the baby's still in the hospital from the birth. It's done very soon, and we don't give Tylenol. You're exactly right. This was a Danish study, so what you would want to do is go back and look at, well, what were the Danish practices? Did they typically do these circumcisions
Mm,
around the time of birth? Did they administer Tylenol? And I bet they didn't. And you're right. If you were to look at the Danish practices, which I'm not aware of, so I couldn't answer that question, you might very well find that they are the same here, and that the vast majority of these children didn't get Tylenol anyway, and that this was something that occurred when they were very, very close to birth. So these are the kind of details that you have to look at in a study before you make broad-based generalizations or jump to conclusions, as RFK Jr. did.
And Dr. Pate, I mean, circumcision is a for many people a very personal decision. For a lot of people, it is a religious decision. So, with that, how should parents be interpreting this research that that RFK comes out and says, "Oh, there's a link," yet there's no proven causation. And again, you're a parent, especially when you are pregnant, especially with a newborn, you want the best outcomes for your child, and you're already feeling stress and pressure, in particular as a new parent.
Absolutely. So here's what I do when I see a study like that has some correlation, but it doesn't prove causation. I look to see if other studies have been done. And did they come to the same finding? And in fact, when you do that, you look at other studies, they've shown no correlation to autism. And then I ask myself the question, well, does this even make sense with based on what we know about autism? And as I explained, it makes doesn't even make sense. So if I don't see other studies reproducing the same findings, if the study was poorly designed and not designed to answer that question that people are trying to draw the conclusion to, and if it doesn't even make sense, then I give it relatively low weight, and I say, if we're really concerned, let's look at some more studies. But just as you said, we don't have evidence. In fact, RFK Jr. Actually admitted we have no proof. The problem is that our public health leaders and the president should not be speaking out on complicated medical issues for which they don't have proof, they don't have evidence. Leave that to their train. There's plenty of expert physicians and scientists in the government. Leave this to them. Not and RFK Jr. has already said, "Don't trust me for medical advice." He's quite
Mm-hmm.
right. We should not be trusting him. If I were to have a baby grandson born tomorrow, I and either of my daughters want, in my opinion, I would tell them circumcise them if you want. And there are health benefits to circumcision. So I wouldn't hesitate a bit, and I would encourage parents do not be confused by the nonsense that gets raised here. If you are concerned about, talk to your pediatrician and get the answer from your pediatrician, and especially if you are not concerned, if there's no reason for concern about autism, it was a healthy, uneventful pregnancy. There's no autism in the family. This is not worth concern. If there are risk factors, talk to your pediatrician and get their advice. But this really is creating an issue out of nothing. There's just no
Mm-hmm.
basis for this.
And speaking of, not taking medical advice from the Health and Human Services Secretary, in a cabinet meeting, I believe late last week, Secretary Kennedy was talking about a video on TikTok that he saw of a pregnant woman taking Tylenol. And he said, and I'm quoting, he stated the woman was, quote, gobbling Tylenol with her baby in her placenta, unquote. I hope he just misspoke, Dr. Pate, and he's aware of where a fetus grows. But can we also clarify that statement? Because it seems silly that we would have to, but I think we are living in a culture and climate right now where people need to understand these basic health principles.
You're so right, Gemma. And first of all, yes, I tend to be inclined to give people the benefit of the doubt. I certainly have misspoken before, and I certainly believe it's possible he misspoke. But on the other hand, I don't have a long history of misspeaking, and he does. And especially when people, admittedly and verifiably, don't have medical training. This is exactly why he should not be the one making these pronouncements. Babies do not grow in the placenta. The placenta is attached to the baby, but the baby grows in the uterus. It makes no sense what he said, and I fear that I hope he just misspoke, like you said, but my fear is he really does not understand these things. And he really shouldn't be speaking on it. And let me just add that my general advice is don't get your medical information from TikTok either. There's plenty of places if you want to learn about things. And I wish he would spend more time talking to the many experts that he has access to in the government, which we've heard from testimony he doesn't avail himself of, and less time watching TikTok.
I want to turn now to the CDC dropping universal COVID vaccine recommendations. Dr. Pate, can you talk to us about what this means now? Because again, there has been so much misinformation going around about this, and so if we can have an understanding of what that means by the CDC dropping this universal recommendation.
Yes, you know, again, one thing that I am trying to do with your listeners, Gemma, as well as the readers of my blog, is not just tell them where things are mistakes or misinformation, but also help train your listeners and train my readers how you can spot misinformation or efforts that are not sincere. And so this whole situation with the COVID vaccines, um, if you step back for a second and look at how RFK Jr. is talking about it and handling it, how the members of the committee are talking about it, you'll notice some things that should set off your alarms. One is um, if they have such terrible concerns as you would think if you listen to what they were saying, it is quite surprising that the president would have received the COVID vaccine last week. He would have listened to them, I'm sure, if he thought they were credible and not gotten it. He got the COVID vaccine, number one. Number two,
Hmm.
um, that when you listen to them, they talk about risks. You will almost never hear them mention, well, wait, what about the benefits? We've been talking about Tylenol. There are benefits to taking Tylenol. There are risks to taking Tylenol. And same thing for vaccines, but you won't ever hear them talk about the benefits. And so when you don't hear a balanced discussion, that should be a warning to you. The other thing is that if you look at the data, the getting the COVID vaccines has decreased the risk of death or severe illness from COVID at every single age group. Some age groups much more than other age group, but it has improved the chances of not dying with severe COVID at every age. They also fail to mention that, and one of the most dangerous things about this new recommendation that you mentioned is if you look at children 6 months of age to a year, they
Hmm.
are at higher risk than I am of developing severe disease. They recommend the vaccine for people my age, those 65 to 74, but they don't make the same recommendation for 6 months to 12 months. Well, why? That makes no sense equal risk of severe disease or death, why wouldn't it be the same recommendation? So you can see the inconsistencies in what they're doing, which means this is not sincere. They're being driven by other factors. And the last comment I would make is they keep on talking about these unknown risks, what risks that might show up later. Well, we've given 8 billion, and that is B as in boy, billion doses of COVID vaccines across the globe. Let me tell you, if there is a new adverse effect that we haven't seen so far that pops up, that means a person's chance of developing that same complication is going to be less than 1 in 1 billion. So I
Mm.
don't think any reasonable person is going to say, oh, wait, there's a 1 in 1 billion chance that this might happen. I'm not going to do that. That's not how normal people make decisions. So this is a continued effort to try to send the message that, oh, you should be very concerned about the COVID vaccines, and you really want to make sure that you talk to your doctor to see if you really should get that. And they're chipping away at confidence in the vaccines, and it's unfortunate. And they're beginning to do it with other vaccines. COVID is just stage one in this anti-vaccine fight, I can assure
Mhm.
you.
So, Dr. Pate, with the CDC taking away this universal recommendation, what does that mean in regards to health insurance coverage? I mean, will COVID-19 vaccines still be covered? Because this is an issue for people who could not afford to get a vaccine if insurance doesn't cover it.
Well, that is correct. Uh, so let me talk about this in terms of if you have Medicare or if you have commercial insurance. That means you have an insurance plan. I'm talking about one that qualifies as like an Affordable Care Act compliant plan. It's not
Hmm.
a special insurance plan, but you buy it through your employer and an insurance company. The insurance companies have already committed that they're going to, and before the last meeting, that they would pay for the COVID vaccines for anybody through the end of next year, consistent with what the old prior recommendations were. Now, there's another thing that should give you a signal. I don't think any of your listeners are going to tell me that they think that insurance plans are very reckless with their spending and just anxious to pay for whatever service you want. The very
Hmm.
fact that they're saying they'll pay for it even if the recommendations change means they understand this is cost effective. Getting a vaccine is a lower cost for them than for treating the illness that you may develop from COVID. So that's a sign. So for most people, it's still going to be covered. What this is trying to do is put a little extra step or barrier in that you may have difficulty just showing up at the pharmacy and them agreeing to give you the vaccine. Now, they should, because individualized decision making, which is how they characterized it, can be done with a pharmacist. And based on the way the recommendations are worded, actually any child 6 months up and above, as long as you have that conversation with the pharmacist or you have it with your doctor, you should be able to get the vaccine. But this is just trying to create hurdles. I think the real question in my mind, we've been led to believe that vaccines for children will continue the coverage. I'm not 100% convinced that's the case, so I'm watching for that. We could see some issues with Medicaid. I hope not, but that's what I'm watching too. I think for most people, you're going to be fine, but for how long beyond next year, I am not sure at all.
We have some listener questions to get to. So, Dr. Pate, William wants to know, what is Dr. Pate's current recommendation for the flu shot? Do it now or wait? And how do we find out more about the rise and fall of the flu over the fall and winter?
Yeah, great question. If you are sticking around in Idaho, it's not yet time to get your flu shot. if you do plan to travel internationally, if you're going to be traveling to the few states where we are seeing an uptick in flu activity, which is Wisconsin, Illinois, North Carolina, Connecticut, or Rhode Island, then yes, go ahead and get your vaccine now. And the other group is if you're not one that you're going to pay attention to this and you got to do it now while you're thinking about it or you won't get it, then yes, go ahead and get it. I wrote a whole blog piece on how I look at timing for the flu shot. And the reason I do this is because if you get the flu shot too early, it's not going to give you protection throughout the flu season. So you might want to watch that or look at that blog post. It also gives you a couple links I provided where I look at flu activity to make my decision. We have very low flu levels, and we have very low levels throughout the year. It's very low in Idaho right now, so I would not get it just yet. I looked back at the last 10 years. If you look at average, my guess is that probably in 2 to 3 weeks, I'll be telling you it's time, but even saving those 2 to 3 weeks can give you or longer protection. So get it now if you're not going to get it otherwise, but otherwise hang in there. We'll tell you when to go.
And Larry writes in, he'd like some traditional advice. He'd like some advice around blood pressure health. He says, traditional advice for diet to lower blood pressure and get a healthier LDL-HDL ratio is to avoid saturated fats like beef tallow. He goes on to say, but there's all this buzz now about the health benefits of things like beef tallow. So he says he's a person that struggles with keeping his blood pressure and cholesterol ratios in line. He's curious about how much saturated fats like beef tallow and lard should he include in a diet that is mindful of improving cardio health.
I'm really glad you brought up this question. I'm not aware of any new data to suggest that people with hypertension and high cholesterol have any need for increasing saturated fats in their diet. But I don't follow this area very closely. So I looked at the American Heart Association's guidance to see if they changed any of their guidance. They have not. They continue to suggest to limit saturated and trans fats, and that is the state of the evidence as I know it. I'm glad that you brought this point up because you mentioned the buzz that you're getting. I think, a lot of people think a lot of this whole activity that we've been talking about for weeks going on with RFK Jr. and the advisory committee has to do with trying to benefit folks that are in the supplement business financially. And so be careful about any of the buzzes for supplements, for other kind of, and a lot of these doctors that spread misinformation, they're also some of the biggest sellers of supplements and all kinds of things that are nonsense. Be very careful of those buzzes. They're going to try to drive you to supplements and things that are not regulated and that are going away from medical advice.
Well, as always, Dr. Pate, we so appreciate you. Remember, if you have public health questions, send us an email, idahomatters@boisestate.edu, and we'll do our best to have Dr. Pate answer those next week. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.